break.
Okay.
Yeah.
All right. Hi everybody. Again, my name is Ezine, and today on the Healthcare Serious Business Podcast series, I have my friends with me. I call them the Health Equity Champions. I guess that they're the Health Equity Champions, and I will allow them to introduce themselves to you. But you're in for a swim because we're going to be answering two questions. What is health equity? And does everybody deserve healthcare? So that's what we're going to be answering today. So stay tuned. So I'll allow my colleagues and my friends to introduce themselves, tell me about who you are, and why this topic interests you. So maybe I'll start with Islam.
All right. Thank you so much, Izini. This is Islam Ahmed. I'm an MPH student at Johns Hopkins School of Public Health. Before coming to Hopkins, I was a social behavior change officer for UNICEF Sudan, and I worked a lot on gender equity for vaccination in Sudan. I've been very passionate about equity in health, and I'm currently doing a gender in health certificate and global digital health certificate. And and I'm interested in the intersection between
She's a true expert.
In the global digital health and gender equity and how we can leverage digital technology to improve health equity. Yeah.
Awesome.
Love it. My name is Dr. Molly Mehta, and I am a general physician from India. I came to the US to pursue my Masters of Public Health, and I graduated from my MPH last year. My interest is in the women's and reproductive health area, and I also did the gender and health certificate. And since I completed my undergrad in med school, I've always been interested in the intersection of health inequities and of how it can improvise patient care. Like that was my source of interest, but then it just potentially grew with time, and especially with the MPH. And I feel that that's one of the roots of any and every public health project or public health that's the root of any impact that any public health project further makes. So excited to talk about it further, and looking forward to it.
Yeah, as you can see, these are the best people to talk about this. I know I'm just here to listen, to learn, and we're all going to learn together. But I want to start off with you, Molly.
Yeah.
I know you've done a lot of work in women health, and you're very passionate. Even speaking to you, you talk about, I want to do this for women health. I want to do this. In your perspective, how do you see health equity? Like,
Okay.
is health equity something that it's achievable,
Right.
or is it something that's far-fetched from your perspective?
I am a very optimistic person, but I would say that health equity as of now is seeming far-fetched. It's not seeming unachievable for sure, but with the current policy changes and just I think all of us together can go on and on with the list of problems that we face in achieving health equity. But it's not impossible. I would say that, and in these many years of experience, I feel like especially like working in India, I think that is where I truly understood of how not just achieving health equity is essential, but achieving health equity that is respectable towards each and every individual is something that I realized, because and just like a very little example to support it is that I worked in I did my internship in and my I worked in one of the most busiest government hospitals, and the patients who used to come there, most of them were from lower middle income classes. So because of that, they didn't have resources to access the top level of private hospitals and very specialized doctors, and due to that they came to the government hospitals. But the way they were treated, they were given treatment, but they were not given treatment respectfully, if you know what I mean. And that is, and although okay, they're getting access to healthcare, but where is the respect, where is the humanity? So I think achieving health equity already does seem far-fetched, but adding the component of respect to it just makes it more further. But I think that's a goal which we should incorporate from now onwards when we're taking little steps.
Yeah, I totally agree with you. Like, it seems a lot far-fetched, given that a lot of things are happening in the space.
Right.
I was on Twitter the other day and I saw a lady tweet about her sister being in the hospital and nobody, responded to them because they felt like they were not able to pay. It's just really messy, like how healthcare for one person is not, another person comes is able to access healthcare.
Exactly.
So I really, really do appreciate your thoughts on that. So I'll allow, Islam to share her perspective. You think that health equity is something that we can achieve in the next 10 years or in the next 5 years from your perspective?
All right, that's a tough one, but from my perspective, I see that health equity is achievable to an extent. It just takes a lot of commitment and will, if I may say, to achieve equity, and also to take into consideration equity while designing programs. So from the very initial, I come from the background of health program, like immunization program design. So there's some programs that are designed in a way that they don't take the needs, for example, of particular groups into considerations. Like, for example, when we're having some immunization campaigns in Sudan, some of them might happen around the time of harvesting when women are in the field. So just like planning when to do the intervention according to the preferences, the needs of the people that you are targeting, can make a big difference. So it's the same intervention. If you do it in the harvest season, you get different results. But if you do it when people are after harvest, people are relaxed, they're at home, they are more likely to respond to the immunization campaigns, for example. So it just really takes that. It's important to have that lens, to be mindful that you want to achieve equity. And the nice thing about equity is that it's very rewarding. So once you're targeting the least advantaged population or the hard to reach population, you achieve big results.
Yeah.
Because if, like, for example, if 40% of your population is in the rural areas, and then you tailor your intervention to the rural areas, then you do get results. And this one makes equity, also working in equity, very rewarding, and it's also very appealing to donors when you say, hey, using your funds, we were managed to reach X amount of people, and also speaking about how you innovatively manage to reach hard to reach populations. Like, for example, you can say we avoided the harvest season and that kind of thing. So it also has that human element that Molly was mentioning about respect, and
Yeah.
Wow, you guys have shared really, really great perspective. I mean, I feel like personally, I think that it's something that I don't know if we achieve in the next 5 years. I hope we can, because there's a lot that comes into play to achieve health equity.
Right.
And coming into the US, I thought that the US had better health equity structure compared to where I was coming from. But I just realized that it's everywhere. Like, there are only few countries that you can easily say you walk into one of the clinics and you get health care for free, just like any other person. So I hope we get there someday. I hope you guys are the future generation of health, policy makers, and I hope that we are able to do our bit to make sure that we support health equity. But you guys are MPH students. I want to ask you guys, what are the biggest barriers you think? Is it financial? Is it policy? Or is it will to do? Like, what are those barriers that you see to achieving health equity?
Molly, would you like to get us started?
Okay, I can start, and then you can, further, both of you can add to whatever I say, because I can think of a few on the top of my head. I think one of the major ones is policy, because I feel that everything gets determined in terms of it being legal or illegal at the policy level. And for example, let's talk about reproductive rights in in the US. Like, for example, not in the US specifically, but in terms of access to what, at the end of the day, what is equity at? And I feel like I'm saying a lot of things separately, but let me combine it and say that again. I would like to start that in terms of equity, there is this one statement that somebody had told me, and that's really stuck with me, that it is like, and I think you guys might have heard that equality is about ensuring that everybody has a pair of shoes, right? But equity is about ensuring that the shoes are fitting, like if those shoes are fitting you. And I think that is where access to healthcare, we can compare access to healthcare to it fitting your like your health, and it ensuring that you aren't limited by the external factors which are not which are posing as a hindrance to access any kind of healthcare. So for example, in terms of like what I was saying about reproductive rights, that I've seen two countries up until now, India and the US, and I'll just draw a very like simple comparison, that in India abortion is illegal. Abortion is legal and throughout the country. So any individual seeking an abortion has equal access to a like to mifepristone equally. Like they can, if they go to the gynac, or if they go to an abortion provider or a gynecologist, or if they have a prescription, they like there is no doubt about them not getting it. While as compared to the US, I mean, some states, yes, which also is questionable like right now, but almost majority like of the states are states where abortion is illegal, and due to that, anybody seeking one has to, they don't have the option of going to maybe like a abortion provider or a gynac to just get the medicine or seek the respective services that is needed for them. So now that option is only cut off, so that is one of the barriers which is sprouting from the policy level of it. And that is one. I think the other definitely is your race and your class, because I feel like that those are two major factors that I saw in India, which were affecting the working of doctors in the hospitals. Like for example, if there is a community which is called the Dalit community in India, and that is referred to as like the lower community by the other religious communities. And if there is a patient who's coming in from a Dalit community, they you can see the difference in treatment by the doctors. And these are doctors who are well educated, they've done their they've studied med school for like 4.5 5 years, but they're still like majority of them. And I would say, I mean, in the space where I was, I'm sure there are exceptions, but I you can, that's extremely sad, because what have they done wrong to be treated like that? So I think race, and of course like class or slash financial situation of the person is definitely another thing that kind of compounds all of this together. And now if you're a woman, if you're from a lower race, if you and you are like maybe from a lower socioeconomic background, so everything is in disadvantage for you to get equal access to healthcare, which is the root cause of health inequity right now. So yeah.
Great point. So I'll let Islam
Yeah, Molly, I think you pretty much covered most of, you hit on those specifics like race, class, income, and even like the wider health system, the policies within the health system. I would also add like, and you mentioned gender, but also like just like specific examples in some part of the world, like where I come from, Sudan, women, like lower class women, less educated women, that sort of intersectionality, women who fall under different intersections, like they're lower class, they're less educated, they could have like financial issues, they're not financially empowered, don't have decisions to seek healthcare. So a woman could be dying in labor at home, but she cannot access the hospital because it's the husband or the mother-in-law that makes the decision of when to seek care. So these type of inequities are also reinforced by social norms, some other social structures that might hinder specifically sexual and reproductive health. They're quite like very I don't want to say tangle topics, and that becomes very difficult to distangle from each other. So working at multiple levels, like at the policy level, at the community level, at the household level, at the individual level, if we're going to look at the socio-ecological model of things, might help improve equity. But because equity requires a lot of work, um, sometimes it's looked at as like it's very hard to achieve. But there are also some leverage points that if you tap into, that you might achieve equity easier. So looking into, for example, engagement of community leaders, religious leaders, is something that we've done in Sudan a lot, specifically in issues around sexual and reproductive health. We have female genital mutilation. That's a big issue. That's backed up by some community leaders, religious narratives. So really distangling all these things around these issues make it yeah. I think a lot of collaboration into cross-sectoral collaboration. And I think as we move forward with equity issues, a lot of collaboration in country and also cross country collaboration might be like beneficial, so people can learn from experiences like Molly from India, some experiences from Nigeria, from Sudan, from other parts of the world. Yeah,
it's a perfect mix example.
Yeah. I love the fact that I think like Molly and Islam have said, policy actually has a very big part to play in terms of equity. I used to be of the school of thought that read this fancy document, the WHO policy on digital health, policy on women health, childhood education. I used to be like, what is that redundant? But the truth is that we actually need this law because we need a guidance, we need direction. But I think what is lacking in most of the world is actually full implementation of these policies, right?
Exactly.
Because it's easy to draft a policy to do this, and then you leave it, years pass by, we've done nothing has moved. So I think that we need to move action oriented, right, to actually implementing what we have.
Yeah. And I think, like you've mentioned, like to move the needle on equity, policies are very important. And I like how you mentioned that there are a lot of fancy documents that I've seen a lot that are being put on the desk. So I read the document, this is really nice, but why isn't it implemented? And in many time, I think I'd also go back to the community engagement, because like in order for you to come up with a document, you have to co-create and co-design it with the community, the key stakeholders, so they can give you context-specific insights into how to implement these interventions. Because what works in the U.S. does not necessarily work in India, might not work in Sudan. So tailoring these and engaging communities and having communities be part of these. So they can get a sense of ownership and even implement it, even when for example, external agencies are gone. But if you have community ownership, they're like, this is our project, we own this, and we want to go forward with it.
Exactly. Both of you touched upon like the implementation of policy, such a vital subject to kind of keep in mind when you're going ahead in terms of achieving health equity. But I feel like with implementation is the first step. I feel a lot of governments and policymakers forget to follow up on the implemented policies, and that is I feel that is a concept which at least like policymakers and governments need to kind of incorporate when they're drafting it. Only just implementing it is not, like, your job is not done there. Like, these are big documents, like Islam mentioned, and these documents are going to require a lot of work to actually drive result. So to have some, like how we say, smart advocacy, it needs to be like we can measure it and be able to follow up on it.
You're right. Very, very true. These are the experts, guys. Employ them. Give them full-time jobs because they are very seasoned professionals and very passionate people about health equity. As someone who is very passionate about the healthcare space, particularly in terms of access, like helping people get access to better healthcare, better what are some of the solutions you think that can help to scale equity, in terms of helping people across the world. In this part of the world, we have a lot of developed, in quotes,
Right.
technologies, developed things. But in your perspective, what are the low barrier tools or low things we can, do to scale equity of health to patients all over the world? So any one of you can start.
I'll start with my
Yeah.
passion, which
Okay.
is digital health and the intersection of equity with digital health. I see that digital health has a lot of potentials for improving digital equity, especially with the digitalization around the globe happening. But I also want to be very careful when speaking about digital health because digital health can work in specific settings, but in some settings, due to infrastructure challenges, lack of access to basic electricity. So you might not be able to charge your phone even if you have one. Some people don't have phones. So some people have, don't have smartphone. They have these small phones whereby you can only text somebody or call somebody. But it is promising. It allows you to reach people that are very difficult to reach. And I can quote an example. We were having a survey around perception on vaccination that I did for UNICEF Sudan after the conflict started in Sudan for youth. So once the survey was out, we got feedback from youth that were in really hot spots, like areas that they're not accessible by land, by air, by we would have never been able to get perceptions from these youth if it wasn't for social media.
Right.
So social media, and especially with gender equity as well, because with access to phones, like many women, they can access information from the comfort of their own bedrooms. That makes it very accessible. But we still have some other issues that are related to the digital divide, how many women have access to phones, how many women have access to internet. But it is a useful tool, but you have to be very careful when we're trying to deploy it, when and how to deploy it, because digital is not always the solution, but it could be part of the solution. Yeah. Even despite my bias and inclination for digital, I have to acknowledge that there are limitations to digital, and we need to be very careful, especially if we're talking about equity, not to leave people behind, people with limited access to technology. Yeah.
True.
Yeah.
There's so many such great ideas and thoughts, and I think in terms of like solutions, to me the power of advocacy is something that I've always like reiterated again and again whenever I've gotten a chance. I think I'll start with that, because I think, as you said, like collaboration, intersectoral collaboration is definitely like one very major factor that is going to change this eventually. But for like, in order to make sure that that is happening, I think commitment is like reinforced commitment, I would say,
And
because
accountability.
And accountability, exactly. Because like today, if you feel that, okay, like you see somebody like on the road, and you feel like that, oh, they're not like somebody who's like asking for money, and then you just like forget about it and go and kind of start gambling, let's say. So like that is something which is that, I mean, not that I'm not saying that person might not be committed, but that commitment needs to be reinforced constantly in your actions. Like this cannot just stay in theory. One, and how do you expect people to speak up? Because a lot of times, because of the practices that have been going on up until now, we're just like that, okay, this is what's been happening up until now, let it go like that. That's easier for people to kind of bear with. So I think two very like basic recommendations, but I think that is that they might help in becoming a game changer, combined with like digital health solutions, and in like digital health solutions, and just in general about of like surveying more, doing more research, and all those things are more complex, but it starts from like motivating and basically conducting more trainings for specialized professionals. Like for example, if you're there was this training that happened in one of the hospitals, and and then it just happened once, and then it was just out, like people forgot about it. So if you're conducting like in-person trainings for seasoned professionals, like for example, there's one training which is just for doctors, or there's one which is for let's say researchers, but there needs to be a group who needs to take accountability like we are doing right now, and make sure that you are constantly working towards it. It's not going to change overnight. So yeah.
I agree with you both. You guys are experts. I don't know what to say anymore. But I agree that what Molly has said now reinforced commitment. We
Yeah.
need that. It's not just saying I want to be a health equity
Yeah.
champion, but you need to constantly reinforce. Why do we want to achieve health equity?
Yeah.
Why is this important? For me, the story goes back to when I was in pharmacy school, and then I met this patient that had her leg cut off for diabetic neuropathy, and she didn't have access to simple insulin, insulin
Right.
that she needs to take regularly, and because of that, her first leg went, second leg, because of she couldn't still afford that drug. The second leg became so imagine
Yeah.
being 20 years old and you don't have two legs.
Yeah.
Like ends like
Yeah.
she literally asked me a question, what can a 20-year-old do without both legs?
Yeah.
I don't know what to
Yeah.
say.
Yeah.
Because
That is true.
that's like
Yeah.
literally how do you move, how do you go to
Yeah.
school? Your life has changed
Yeah.
drastically because of lack of equity for healthcare, and that's why that's my driving force, to do something in this space. So I don't know what I mean. We are part of the young generations, and the people, the current people we have right now, they've done their best in terms of like driving health equity and all. We know a lot is happening right now in the healthcare space globally. Funding, lateral organization, donors, all many things are happening right now. But in your perspective, what role do you think young people have to play? In driving young people like me and you, in driving, the voice, and driving the not actually voice, the action of health equity globally. That's a
A good question.
Take a deep breath.
Yeah.
Yeah.
I would like to start on that. I looking at it from this, like just seeing what has been done in the space already. Looking at different countries with different experiences, like Molly has mentioned, there are different countries with different like levels of access to healthcare, and see what they have done, and then trying to learn from that and also adapt to our context, but and also being mindful of 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 that. I think we're all better off when we are doing well,
Yeah.
that kind of
Yeah.
notion. So it's also looking at it from the lens of, and I can speak to equity. I've been in Sudan before the onset of the war and during the onset of the war, and I think one of the main driving force of war was the lack of equity. Some people feel bitter that they didn't have access to education, they didn't have access to healthcare, so they were like, okay, we're going to wage a war because we want to get more resources. So if you think of equity, like it has implications on you yourself.
Right.
You might not see it now, but it can come back at you. So like for me, as someone who was living in the capital city, Khartoum, at the time, I had to leave my home because the whole issue was a problem of injustice and inequity that resulted that. But maybe if we had worked together to improve equity,
True.
yeah, maybe we wouldn't have been in this position. So equity is just not about others. It's also about
Yourself.
us, about your future, about the future of coming generations.
Right.
So looking into equity as a big picture, and that and yeah, and when like and and also while we strive to achieve equity, we have to also make sure that we are good. Yes,
Yeah.
because you take care of yourself, so you're in a
Yeah.
position to support others.
Yeah.
So try to balance these two, and I think
Yeah. You said a very big thing, really. But yeah, I absolutely agree, and I feel that with youth is such a powerful section of the population, and I think people are starting to realize and recognize and acknowledge that more and more in the current generation. Like, I think in the past 5 years, the involvement of youth has been tremendously like an upward graph, and and that's a good sign. Like, it's a stepping step, it's a step ahead. And I think that the youth is already making its way in terms of having a seat at the table and ensuring that their voice is heard, because they like their experience. I think it's important that the youth is able to put across their experiences to policymakers or to stakeholders who are involved in making decisions that affect equity at all local, national levels, and just give them the perspective of how it is affecting you. And like connecting it to what Islam said, you won't know how it affects you until you observe around you. So just, I think, keep your eyes open. And these are things which, when I say it out loud, I'm also thinking that, okay, Molly, these are such logical, like, things to do. But it takes one conscious reminder for to in order to observe and then take collective action. I feel like that equity is also very intricately linked to collective effort, and that means youth is a very big part of that collective effort. So it's important for even the youth to acknowledge of the work that the other stakeholders are putting in. They have the advantage of the experience they're bringing to the table, so it's important to acknowledge that. And it's also important for the stakeholders to acknowledge that they are bringing in fresh experience that they might not have access to. So I think it's like a intersect, like it's a middle ground ultimately, that both the people, like both the stakeholders involved here, need to kind of bring together. And the youth, I think, like being a part of the youth community, I've felt this multiple times. I don't know if you guys have also felt it, that when you're in like meetings, or when you're at the table, it sometimes does feel intimidating for you to like propose something that you think is too different from what other people are saying. But now that's your experience, like how do you change that? So I think from my own learning, I have tried to be not afraid to like speak up and like put my point forth, and make sure that that point is being considered in terms of some action. It doesn't, like, nothing is going to happen if it just stays until words.
So I agree with you.
Yeah, I think speaking out and having a supportive environment for youth, like even
Yeah.
individuals in decision-making positions, like including youth in committees,
Right.
listening to the perspectives of youth, because especially in matters that are related to youth, as a youth are key stakeholders. I think as youth, we have a lot of energy. We are often very enthusiastic, and we want to make a lot of change, but we also lack experience. So having to sort of collaborate with mentors, to collaborate with people who have been in the field, who are supportive of youth engagement, can help youth get a long way, and that sort of created an intergenerational dialogue, if we might call it.
Absolutely.
So everyone is on the same page, and I think there are a lot of people out there in the world who are willing to help and support youth.
Right.
And and with digital media and platforms now, youth can voice their concerns through social media platforms, and it can reach, like, you can build a network of community of similar interest, even if they're across the Atlantic or they're across the globe. So you have the opportunity to network with like-minded people now more than ever.
Absolutely.
And that is very helpful. So making use of the technology that we have and the leverage that youth have today.
Right.
Yeah, that's absolutely important.
Thank you. I mean, you guys raise really valid point, because I feel like young people have a very crucial role. We need to learn from our lessons. Like, learn our lessons from what has worked, what has not worked, and how can we improve things.
Right.
So youth, we need to speak up, we need to share our ideas, share our thoughts in forums, get into rooms that you typically don't want to enter. I remember the first time I ever sat in the policy, review room. I was the youngest person in the room. I felt really awkward,
Yeah.
I get it.
I felt really awkward because I was like, oh, look at this young girl. How old are you?
Right.
You're this school. What do you?
Yeah, the imposter
What do you have to
syndrome
bring
is-
to the table? That kind of
It's
question.
really hard.
It
for
is.
young people.
Right.
Especially for young women, I would
Yeah.
also like
Very
being
true.
speaking of
Oh
that
my God.
intersectionality, being a young person, being a young woman,
Right.
trying to voice your concern in different
I hope we break free of this barrier.
Yeah.
Where young people feel comfortable
Yeah.
sharing their ideas and sharing their thoughts.
Absolutely.
Absolutely.
May I just add, like, one last thing to this? Like, it's that I feel like that a lot of times youth tends to, see other youth as like competition and,
Yeah.
just like a race
Glad you
of,
brought that up.
yeah, like, and to be very honest, I've seen it like, in my undergrad program, in my postgrad program, and it's like a race that, who gets to the finish line first. It's not about that. Like, I think the idea of like collaboration needs to start when you are engaging in these discussions more. Nobody is competition here. Everybody is bringing something to the table, and you, like, as youth, I think it's important for us to realize that it's collective action, like I said before, that is going to get us somewhere.
You're right.
So
Yeah, and everyone has something to offer.
Exactly.
So it's not a zero-sum game.
Exactly.
When you are Molly has something to offer, Izini has something to offer, I have something to offer. Everyone has a unique something to offer. It might be on us to figure out what we have to offer and what we are passionate about, what do we have skills in, what we excel in, so we can put that into work. And I think once you find your niche area,
Right.
I think you're set to go, and there's never been someone like you. There'll never be someone like you. You're unique.
Right.
Yeah.
You are
absolutely.
unique. Absolutely.
Yeah.
I'm actually very big on collaboration. That's why we have this.
Yeah.
podcast. I believe that we all have unique things.
Yeah.
We all want to achieve a goal, right? Make sure people are all over the world live better lives.
Right.
Have better access to healthcare in wherever they are, wherever they find themselves, regardless of where they're born, regardless of the family they come from. And I think it can't work if we're all still in the high horses and not willing to work with each other. So thank you for raising that point. That's a really, really valid point. Before we close out, this has been a very fruitful discussion. I've learned so much from you both, your perspective on healthcare. I'm going to ask you, I'm going to close out with a question. If there's one change you would like to make in the world in terms of like healthcare, health equity, what would that be and why?
That's just
think about
asking one change, but it requires so much thinking. Okay.
Because there are many things, so you have to filter out what is the one thing you want to change.
Exactly.
Okay.
Oh.
I have so guys, take a moment, maybe I can start.
Yeah.
Okay.
Feel free to.
I mean, for me, if there's one thing I would like to see like change in healthcare equity, is like equitable access to medicines. Right? For me, I believe that medicines are very crucial, like they're very, very important. I want a scenario where I know the pharmaceutical system is actually very, very complex. Globally, not just in the US, everywhere. But I feel like everybody should be able to afford the medicine they need.
Yeah.
So if there's one thing I would like to see in terms of health equity, to be equitable access to medicine, right? So if you have any ideas, if you have anything you want to, you need to work with somebody, I'm the person to talk to because I'm really passionate about it, and that's kind of like where my career path so far has tracked and where I think I'll be going in the next few years. So for me, that's the one thing I would like to change: equitable access to medicine. So anyone of you can go next.
I think mine is a bit more broad, and I would like to see women able to access the healthcare that they need and they want. So that's where I'm coming from. But I think there are multiple areas depending on where you're working. That can be a priority at that time in terms of access. But what really breaks my heart the most is when seeing people dying of malnutrition. That is something that I find very painful, and I think it's, and this is the reason why I came to public health, is that I witnessed a otherwise healthy 2-year-old child walk into the hospital with his own feet, that he dies within the hospital because of malnutrition. And I find that is extremely painful.
Yeah.
It is. So yeah, I wish that on nobody, and I wish we see a world where children don't have to have to
Absolutely.
die of like sort of preventable causes. Yeah.
Absolutely. I think for me, I like two changes are coming to my mind. So I'll try to tie
one is
both of them
difficult.
together. One is difficult, but I think the first one is to make equity loud. I think that is one thing which is.
What do you mean by loud?
So I when I was thinking about this like tagline just came in my head, and then I was
Like
like
the
okay,
Jennifer Lopez song, "Let's Get Loud."
yeah, let's get loud, yeah. And I think what I mean here is that although it is an emerging concept, and more people are working on it and getting to know about it, but there's still a very large section of the population that is not aware of the word equity. Like, I think equality is still very well known, but as basic as we when somebody tells us, do you like the difference between equality and equity, we'll just be like, what is this question even, it's so obvious. But I think there's still a very large section of the population that doesn't understand that. And as I said, that it's going to take a lot of reminders, a lot of repetitive efforts to get where we are aspiring to be. And um, and in this process, the second one is tied with this, that I feel that you need people, like in the definition of equity, the word respect needs to come, because it's not a two-step process, that okay, you ensure everybody has access, and then you ensure that everybody is respected. Like, it needs to be tied into when you are making sure that it is accessible to all. So I hope that we see a world very soon where we don't see anybody dying of malnutrition, where we see women and disabled populations and the LGBTQ people accessing healthcare without any social or financial or racial barriers. And that is, I mean, I can't imagine one person for whom that is not good. So I don't understand. I can't think of a reason of why we shouldn't march towards it constantly every day. And yeah, there's only effort that we can put from our end, and this clearly is like an example of that the initiative that you took. So I think we're getting there very slowly on a turtle at a tortoise's pace. But it was the tortoise who won the race between the rabbit and the tortoise. So I think we will also be that person who wins.
Yeah.
Yeah.
So, ladies and gentlemen, I present to you your equity champions. Thank you so much, guys. This has been a really, really fruitful discussion. I've learned so much about what equity means and how we can, bring down the barriers, the things around, reinforce, commitment, the thing around digital health, place of digital health, speaking up. These are important keywords that we need to keep reminding about ourselves of as young people who are in public health and trying to do something to help healthcare. So thank you, guys. Thank you. Thank you, audience. My name is Ezine again. I'm the host of the Healthcare Serious Business podcast series. And I'm with my friends. These are the equity chapter. Please connect with them. They are really, really great people. And if you are looking to do something in digital health, Islam is your go-to person. If you are looking to do anything in women's health, Molly is your go-to person. And these are really great people who have the expertise, the skills, and experience to support healthcare globally. So thank you again, and see you again next time. Bye.
Thank you.
Bye.
Bye.
Thank you.